Community Health Assessment Project for Nursing 408-810. Members are Caitlin Harper, Jackie Jameson Allen, Catherine Gorham, Heidi Simpson, and Annalise Kasaya. We were assigned the Charlotte-Mecklenburg region, which is one of the fastest growing Hispanic communities in the country. This population has experienced disparities in health outcomes and has diminished access to health care services. Hispanic women face a range of reproductive health barriers and disparities. Many of the differences can be attributed to the lack of adequate health care coverage and access to services. These women also have limited access to culturally competent and linguistically appropriate care, as well as crucial reproductive health information. As a result of these barriers, Hispanic women are more likely to forego essential preventive care, including prenatal care. Prenatal care is an essential reproductive health service that ensures women have healthy pregnancies. Adequate prenatal care goes beyond just monitoring fetal birth weight. Access to adequate prenatal care actually improves the health of the women as well. Prenatal care reduces risks of maternal mortality, which is relatively high among Hispanics. And despite documented benefits, many barriers prevent Hispanics from accessing prenatal care in traditional clinical settings early in their pregnancy. A windshield survey was performed, which is a simple assessment of a community where one can observe the characteristics and environment of the community. A windshield survey of Mecklenburg County was performed, focusing primarily on the city of Charlotte, as this is the biggest city found in Mecklenburg County. You can see from the image here that Mecklenburg County boundaries include 6 other counties that surround it. Houses and zoning for the area. There is a wide variety of homes, including apartment complexes and condos, townhomes, and they're primarily made of brick, wood, vinyl, and concrete. Some of the homes were older, appearing to be built in the early 1900s, and some were new construction. While some houses in affluent areas were large and well kept, there are also houses in lower income areas that were smaller and more run down. And it appears that a majority of Spanish-speaking residents in Mecklenburg County live in the lower income areas. Overall, the housing appears good. There were very little abandoned homes. Here's some images from Mecklenburg County. The most common form of transportation appeared to be cars. However, many people were seen walking through neighborhoods and riding bicycles. There are other forms of transportation, public transportation, such as buses and the light rail. Since many areas of Mecklenburg County are spread out, it seems it would be hard to get around unless you did have a car or used public transportation. Social service centers. There are a variety of parks that offer free recreation, including tennis, soccer, baseball, and playgrounds. Several pharmacies were seen while driving through the county, indicating the community has adequate access to pharmacies. Mecklenburg County has numerous recreational centers, such as the YMCA. There are also doctors' offices, OBGYNs, dentists' offices, eye doctors, urgent care, and internal medicine. Numerous schools were seen, including elementary, middle, and high schools, as well as colleges, and the appearance of all of these establishments seems to be in good condition. Here's some more images taken from Google Earth of the Mecklenburg area. There are lots of stores, including grocery stores, which indicates easy access to food. There are many Latino and Hispanic stores found throughout Mecklenburg County. Many people drive, walk, and take the bus to grocery stores, and there are a lot of bus stops within walking distance. Overall, Mecklenburg County appears to be well kept. It's clean with very little litter. The roads appear to be in good condition. Many streets have sidewalks, and there's adequate street lighting. A culturally diverse community was observed, including Caucasians, African American, Hispanics, and Asians. The most common religion in Mecklenburg County appeared to be Christianity, as there were a lot of Christian denominational churches seen. Catholic churches were also common, and Mecklenburg County did have some temples and mosques as well. There are many corporations that are located in Mecklenburg County, including Bank of America, Duke Energy, Atrium Health, Wells Fargo, and Novant. which provide a lot of jobs to residents in the area. There are several small businesses in Mecklenburg County as well. Health indicators, there are many hospitals in Mecklenburg County, including the Level 1 Trauma Center, Carolinas Medical Center, which is located in Uptown Charlotte. There are several OBGYN clinics that have bus stops accessible. An interview was performed with a nurse that works at an OBGYN clinic in Charlotte, who estimated that there were 30 to 40% of the clinic's population being Spanish-speaking. The transportation was available to them. There are bus stops directly outside the office, and there are in-house interpreters, as well as phone interpreters in patient education in Spanish. This nurse does believe that language poses as a barrier for the Spanish-speaking clients, despite the fact that there are interpreters accessible. The nurse found that patients were typically willing to be compliant as long as they understood what they were being instructed or taught. Sometimes there is miscommunication despite the fact that interpreters are used, and that there are a lot of barriers as well to women's access to OB care, including health insurance, the cost of health care, immigration status, language barriers, and transportation problems. There are major health issues in the area, including mental health, obesity, hypertension, hyperlipidemia, and smoking. Communicable diseases were pertussis, salmonella, and tuberculosis. And the ethnic racial groups were white, black, Hispanic, Asian, and other. 19.4% of languages spoken at home were English. You can see some other numbers here as well. Community health priorities were mental health, access to care, chronic disease prevention, and violence prevention. Community health status, the people with less education and income tend to live in the neighborhoods which lacked access to nutritional foods, safe places to exercise, and protection from exposure to alcohol, drugs, and other risk factors for disease. In Mecklenburg, 6 zip codes formed a crescent-shaped area of poverty and low educational attainment around the center of Charlotte. This area, known as the Public Health Priority Area, is linked with higher rates of chronic diseases, infectious diseases, and deaths related to these conditions. Mental health, 16% of adults said their mental health was not good on at least 8 days in the last month, and Mecklenburg County aims to improve mental health status of adults and children in the area through the creation of a trauma-informed learning community and increasing access to and development of psychiatric advance directives. Access to care, 28% of adults were without a primary care physician, and 19% of adults were unable to see a doctor due to cost. This led to chronic illnesses being left untreated and increasing the disease and mortality rate. Mecklenburg County does aim to improve access to care for all individuals and families, regardless of their ability to pay, by increasing the number of appropriate healthcare access points in the priority area and providing navigation services to connect people to health resources. Chronic disease prevention, hypertension, 28% of adults. Mecklenburg County aims to reduce the percentage of adults with diagnosis of hypertension through increasing the number of the Village Heartbeat churches participating in check change control programs and identifying and referring food insecure individuals to mobile food pharmacies. Violence prevention, 21.1 crimes per thousand. In the Lakewood community, Mecklenburg County aims to reduce the incidence of violent crimes in Lakewood through administering surveys to learn about community safety and offering Stop the Bleed trainings and domestic violence resources. Strengths, creation of a trauma-informed learning community and development of the psychiatric advance directives in an effort to improve the mental health, providing more navigation services to aid in locating resources and increasing the number of healthcare access points for better access to care, providing healthy foods to food banks, and more check change programs to help prevent chronic disease. Weaknesses were limited access to services for healthcare in needed areas, especially within the Spanish-speaking population. Mecklenburg County schools lack the number of needed counselors to help with growing mental health issues and suicide rates among students. Lack of insurance or funds to pay for healthcare services to treat issues such as hypertension and mental health issues. Mecklenburg County, mental health is the top health issue addressed for this region. Mental illness impacts 1 in every 4 adults. 2/3 of those adults with mental health issues will not receive the services they need. And the cost to our society for untreated mental illness are found not only in economic terms, but also in the volume of disability cases, high unemployment figures, homelessness, needless incarcerations, and the most tragic cost, suicides. Community diagnoses are disturbed personality identity related to psychosis, ineffective coping related to psychological impairment, substance abuse, and ineffective therapeutic regimen management related to chronicity of condition with unknown prognosis. Here are some interventions, primary interventions for assessment of personal and family health risk factors, appropriate screening tests, and prevention strategies. Secondary interventions, assessment of pregnancy status and gestational age, and other prevention strategies. Tertiary factors, assessment of psychosocial risk factors, addressing postpartum and prevention strategies. Our conclusion is Mecklenburg County is growing at a rapid rate and is striving to ensure the needs of diverse population are being met. After assessing the data, we have come to the conclusion that the mental health is the top health issue in the county. Whether due to people being left without insurance or insurance refusing to cover mental health costs, this problem is becoming more widespread in Mecklenburg County. Assessing the areas in most need of mental health services helps us to narrow down the demographic-specific interventions. The county is striving to create a trauma-informed learning community and increase access to and development of psychiatric advance directives. This learning experience has increased our cultural, racial, and social economic awareness in Mecklenburg County. As nurses, understanding the various constituents of the population enables us to define priorities in regard to the need of the county as a whole. This makes us more aware of what considerations and interventions are necessary to aid in the overall health and wellness of the community. And here are our references. Thank you for watching.